Prior to placing your impression material on the fork, it is a good idea if you just recline your patient and have them sit for about 5 minutes with the fork at the location of where your start position is going to be for your oral appliance. At that point, when you come back in the room and the fork is in the patient's hand, then you kind of have an idea that that patient was fatigued, and you can actually reset that to a more conservative bite position. Having followed these steps, now you're ready to use your impression material. In this case, we're using the AccuFlow. What you want to keep in mind is to only put your material on the perforated portion of the upper and lower segments of the bite fork. Most importantly, make sure you do not put any of your impression material on the divots where the upper and lower anterior teeth will sit. That will disturb the vertical dimension that you've already measured with the 5 or 2 millimeter fork. Once the material is loaded onto the fork, simply place in the mouth, remembering to line your midlines up with the line that's marked on the fork itself. Remember to record where you took the bite registration, as you will need to refer to it for your baseline records. Once your material is set, simply remove from the patient's mouth and just take a look at it to make sure that nothing is in that area that will affect the vertical of the bite registration. You can see here on the upper, we've got a nice indentation of the upper teeth and nothing on the anterior region. Same thing with the lower, and nothing on the divot for the lower teeth as well. Now you're ready to send the bite fork along with your models and prescription to the laboratory. Keep in mind the forks are disposable, however the George gauge cannot be autoclaved and needs to be chemclaved or cold sterilized.